post-traumatic stress disorder, what is dangerous and how it manifests itself in children and adults. Do you often struggle with unreasonable feelings of anxiety and can't forget the traumatic event? These are all symptoms of PTSD, post-traumatic stress disorder. Post-traumatic stress disorder can develop not only as a result of a single traumatic experience, but also as a result of a constant stay in nervous tension. PTSD is diagnosed in people who had to deal with various difficult events and situations, as well as in people who are only witnesses of a traumatic event. Approximately 20% of people develop post-traumatic stress disorder after a traumatic experience, with the problem most commonly diagnosed in women. Symptoms of PTSD. Both the background of post-traumatic stress disorder and its symptoms can vary significantly in each patient. It happens that the symptoms of PTSD are underestimated by the environment of a person experiencing stress. It is often difficult for relatives to understand the behavior of the patient. Sometimes a complex post-traumatic stress disorder, PTSD complex, is diagnosed, which is associated not with one traumatic event, but with many traumas that the victim has experienced throughout his life. PTSD symptoms do not have to appear immediately after a negative experience. It happens that signs of such a disorder appear only a few weeks or months after a negative event. As a rule, the clinical picture of PTSD consists of physical and psychological manifestations. Physical symptoms: hyperactivity and excessive alertness, sleep disturbance, trouble concentrating and having difficulty remembering, irritability, tearfulness. Causeless anxiety may be accompanied by profuse sweating, rapid pulse, shortness of breath. Psychological symptoms: re-experiencing the traumatic experience through flashbacks or recurring nightmares. Constant attempts to avoid places, people, objects that remind of a traumatic event. In the International Classifications of Mental Illness, post-traumatic disorders appeared only in 1980. Since then, the understanding of PTSD and the mechanism of its development have constantly changed and modified. Currently, such a diagnosis is based on the presence of a single, threatening or frightening event in a patient that provoked the appearance of three main symptoms: re-experiencing a traumatic event in the form of intrusive memories or nightmares, accompanied by strong emotions, fear, panic, anxiety. Avoidance of thoughts and memories of the event, situations and people, reminiscent of the traumatic experience. The development of overly heightened vigilance, an acute reaction in the form of startle to stimuli, for example, an unexpected noise. To be diagnosed with PTSD, these symptoms must have been present for at least several weeks and significantly interfere with normal life. A new form of the disease has also been identified, called complex post-traumatic stress disorder, which is often associated with experiences of chronic childhood stress. PTSD in adults. An adult suffering from post-traumatic stress experiences constant tension, increased sensitivity and anxiety as the body tries to prepare for re-experiencing the trauma. A constant sense of danger over time worsens concentration, causes indifference and even a feeling of alienation. The patient begins to isolate himself from people, abandon his former interests and activities, may become overly irritable, explode with anger, or respond inadequately to any situation. In addition, PTSD in adults is often accompanied by insomnia and the development of obsessive-compulsive disorder. Patients with post-traumatic stress disorder have an increased risk of developing physiological disorders, somatoform, cardiorespiratory, musculoskeletal, gastrointestinal diseases. PTSD in children. The symptoms of post-traumatic stress disorder in children are similar to those in adults, but may present slightly differently. For example, young children persistently recreate a tragic event through games, stories, or drawings related to the trauma. They often become hyperactive, irritable, cry in seemingly unexpected situations, get nervous, have difficulty concentrating and remembering. PTSD in children can lead to social isolation, loss of skills, and even developmental regression. Older children often have low self-esteem, self-destructive or risk-taking behavior, and a tendency to use psychoactive substances. Typical symptoms in children include sleep and eating disorders, as well as the development of gastrointestinal disease. Diagnosis of PTSD and methods of treatment. Diagnosis of post-traumatic stress disorder is not easy and requires the ability to recognize it among other mental disorders. Every person diagnosed with PTSD needs to begin treatment that not only gets them through the tough times, but is also critical to overcoming fears and worries. For example, cognitive behavioral therapy is used quite actively in the diagnosis of PTSD, helping to learn how to cope with stressful life situations. In the treatment of PTSD, in addition to the psychotherapist, a psychiatrist is also involved, whose duties include the selection of drugs that reduce the symptoms of mental disorders. Post-traumatic stress disorder is manifested by certain behaviors, psychological and physical symptoms that prevent a person from leading a comfortable lifestyle. Post-traumatic stress, no matter what caused it, always requires the participation of a specialist. In the case of PTSD, the help of an experienced psychotherapist, as well as a psychiatrist, is always needed. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Hope seeing you back on Lify Life.